Hi, I'm Dawn Morse, the founder of Core Elements Training, which delivers Level 3, Level 4 and Level 5 sports massage and sports therapy training courses.
I'm Katie Campbell, I'm a lecturer for Core Elements Training. In this series of videos we're going to be looking at the examination assessment for the peripheral joints, focusing on range of movement, ligament testing and muscle testing. In this video we're going to be demonstrating the examination and assessment of the shoulder joint. We're going to be focusing on the range of movement and muscle testing. We're going to show first the active, passive and the resisted movement of flexion. So we ask the client just to bring their arm up to the ceiling as far as they can and relax. So we'll be testing in real life, comparing the good to the bad. Ask the client to do the movement again, bring their arm up in full shoulder flexion, supporting at the shoulder. We take this passively, gently further in the movement and relax. For the resisted movement, we repeat these steps. So full shoulder flexion, the therapist passively increases the movement. We ask the client then to try and bring their arm back down and relax. Good practice is just to support the elbow joint as well. So if you ask the client to come up, you can support at the elbow and the shoulder. Resisted movement, the client tries to reverse the movement, bringing the arm back down to the floor. For extension, we ask the client to bring their arm back behind them, and just turn slightly. The client bring their arm down behind them and relax. For the passive movement, the active part, the therapist, the client performs the active part, brings their arm behind them, therapist supports at the shoulder and at the elbow, and just bring the movement further and relax. Repeating these steps for the resisted movement, again supporting at the shoulder and the elbow, the client brings the arm behind them, the client relaxes, the therapist moves the joint a little bit further, and then we ask the client to resist the therapist while they bring their arm back into the starting position. Therapist supporting at the shoulder and around on the inside of the elbow, biceps, and relax. As flexion and extension, we can also use abduction going into adduction, because it will change at about 90 degrees. So we ask the client just to bring their arms out to their side and up over their head, bringing their upper arm towards their ear, not their ear to their arm. So that's the active movement. You can judge to see how far that is. Ask the client to relax. For the passive movement, we ask the client to perform that movement again, supporting again on the opposite shoulder and just underneath the elbow. Just increase that movement, moving their upper arm towards their ear with the client relaxed. For the resisted movement, we repeat these again. So the client just brings their arm up near their ear. Therapist supports on the shoulder and elbow, bringing the arm closer to the ear. The client then brings their arm back down to the starting position while therapist is holding the arm. 3 seconds and relax. You can also do external and internal rotation in standing. So internal rotation, it's good practice to just start the elbow and the arm outwards. Ask the client to flex the elbow. This creates an internal rotation. As they bring their hand behind them, they try and get their hand as far up their back as they can. You can also judge on their top or back to see where the fingers rest. Again, you'd compare good to bad. Ask the client to just relax their arm as you would test the other side. For the passive movement, we ask the client to perform the beginning of the movement again, bringing their hand up behind their back. The therapist then supports at the elbow and just holds their wrist. They just bring their hand up a little bit further, increasing the range of movement and just relaxing. Always checking for discomfort. Now we do resisted movement. So again, we ask the client to perform the active part of the movement, bring their hand up behind their back. The therapist will support their elbow and their hand at the wrist, increasing the movement slightly. And with the client relaxed, just ask them to bring their hand back into the starting position, trying to move down away from the therapist. And relax. So that is the internal rotation. For the external rotation, we can go above the head. So again, we have the arm coming outwards at about 90. We ask the hand to come up and externally rotate as much as possible, and that they can reach down above their head, see how far down their back they can go. So that's the active. And again, you can judge with any patterns on their top. Ask the client to relax as you would test the other side, and that's the active movement of external rotation. Passive movement will be the client takes it into the movement themselves. So they reach down behind their head, down their back. Therapist can support at the elbow again, and they can just hold at the wrist. Just rotate. So here, we just hold at the hand and the wrist here, and we just gently bring the movement, increasing the movement, bringing the hand further down their back. And relax. For the resisted, we repeat these 2 steps. So we ask the client to bring their arm outwards, externally rotate, bringing their hand away behind them, and the hand comes down, reaches down their back. Supporting at the elbow, they can relax. Passively, just bring their hand a little bit further down their back. And then when you're ready for the resisted part of the movement, they can try and bring their hand back to the starting position as you're resisting. Holding that for 3 and relax. Remember, their hand and your hand shouldn't move too much. Don't be afraid to ask the client to repeat the movement. So that is the range of movement of the shoulder joint. We can now test the rotator cuff muscles. So here we have the Superspinatus. So we ask the client to bend their elbow, bring their elbow into them, and it's often easier if you ask the client to face away, using the opposite hand on their opposite arm, pushing their elbow into their side. They just try and bring their elbow out away from them, and relax. So that is testing the Superspinatus. If you ask clients just to face back towards you, you can now test the Infraspinatus, which is responsible for lateral rotation. So we hold the elbow there as well. But what we want to ask the client to do is just to bring their arm outwards while their elbow is tucked in. So if you just face me, so we can just hold their support their wrist, and they're bringing their arm outwards. You hold their elbow, so you know that's the only movement taking place, and relax. For subscapularis, we'll be exactly the same position. This time they're going to try and bring their arm inwards. So ask the client to bend their elbows tucked into their side. They're just pushing against you, bring their hand further into their body, and relax. So that's Infraspinatus, Superspinatus, and subscapularis. For Teres Minor, we need them to bring their elbow into their side while you're resisting, and they are going to also be trying to laterally rotate while you're resisting as well. So you just pop your hand on the inside of their elbow. They're going to squeeze their hand to their side, and then they're also going to laterally rotate as well. So they push outwards and inwards with their, so outwards with their wrist, inwards with their elbow, and you're resisting both movements. And relax. So that's Teres Minor. So that's the 4 rotator cuff muscles. We can also test the deltoids. So if you'd like to turn around. So if you ask the client just to bend their elbow and abduct it to about 90. Focus on the elbow coming up. For the middle past the deltoids, they bring the elbow upwards with you resisting them. And relax. The anterior part of the muscle, we are exactly the same position, flex at the elbow, 90 degrees there, and you're just going to hold their arm as they try and push further forward, and relax. So they start in this movement and they're trying to bring their arm forwards. For the posterior deltoids, they start in this movement, they just bring their arm backwards. Again, start them back in neutral, support the back of the arm, and they bring their arm backwards against you for the posterior deltoids. That's the middle, the anterior, and the posterior. Rotate right around here. So here we can also test the pectoral muscles. So you've got the sternal fibres and the clavicular fibres. Here, just bend the elbow like this, and they are going to try and, like a Superman movement, up for the clavicular fibres. So you can pop your hand on their bicep, and they're going to try and push their arm towards the corner of the ceiling. And relax. You can also support on the other shoulder. You can ask them to do it again and just push up, just for a little bit more support. And for the sternal fibres, again a little bit higher than 90, and this time it's going to push to the bottom of the floor. So again, you can support on one shoulder and the arm here, and then your actual client just to resist you, push down against you. And again. So if Dawn does the movement without me, we've got the clavicular fibres like this, and the movement that the client performs is that. And for the sternal fibres, the movement the client performs is that, and you're just trying to resist that movement.